Okay. Hi, my name is Raposa. I'm from New Bedford, and I want to thank you for the opportunity to speak here today. I'm not a nurse. I don't work in a hospital, but I have been a patient. I'm a cardiac patient, and I have been for the last 6 years. I'm here today not to speak about what you have included in these regulations, but about what has been left out. And I think it needs, needs to be there for patients and their families, patients like me and families like mine, because when I'm hospitalized, my family really goes off the deep end. Patients and their families need to be informed of the new ICU law, limiting the number of patients an ICU nurse can care for at one time. And I can't stress enough how important it is for families to get this information, and even me as a patient. I'm left sometimes hanging in the air with questions and nobody to answer them. Information about the one-to-one or certain cases of 1 to 2 nurse to patient limits should be posted in the hospital where families can see them, or given to the families and patient as soon as they're admitted into ICU. They need to know the standard of care for which they are entitled to. It should also be included in any written materials provided by the hospital, which sometimes they don't come by very early on into your admission. So if there is any disagreement as to the patient's acuity, and the patient is assigned to a nurse who is already caring for another ICU patient, against the advice of the ICU staff nurses, the family should be informed of this dispute and the reasoning behind it, and not to follow the advice of the ICU staff nurses. We have a new system in our local hospitals in our area, and I'm not really happy with a lot of the changes that they've made there. And so this is very important to me, and I'm going to study up some more on this when I get home. Laws are in place to protect the patients, and it is critical that in very stressful times, such as an ICU admission, that the patients and their families, especially my family, are aware of their rights under the law. If you do not require this in the regulations as part of the requirement around public reporting, you are leaving it to the individual hospitals to decide how patients and their families will be informed about their rights, and that scares me. Thank you.
Thank you so much.